This is our battery charging station. Each stretcher has a number, and each battery has a corresponding number with that. If you've noticed, they're written on here: 1, 1, 2, 1 through 3, 4. The way we've set this up is if the batteries are turned sideways like they are in front of these, that means they're already charged. If you see a red light, obviously that means it's charging. If you see a green light, that means it's good to go. But if you notice, each one has 5, 3, 4, 2, 1, whatever it may be. Again, remember, if it's sitting sideways, that means it's charged, ready to go.
Hi, this is the Power Pro XT6500 battery powered stretcher. It is equipped with many accessories: side rails, seat belt setup, blankets, sheets, pillow, um, brakes on the wheels. This is the battery that controls the stretcher. Insert it like that. The plus and minus signs indicate raising and lowering the stretcher. Plus to raise, minus to lower.
When you come in the morning and before you head out on your shift, you're going to check your stretcher and all the equipment that you need to run. We have a checklist right here, so we're going to just go ahead and follow it. The first thing we're going to do is inspect the wheels, the frame, and the straps. So you'll go ahead and make sure that all of your straps that you have here are good, not frayed. You will also then check your wheels down here at the bottom and make sure your brakes work. Second thing, this stretcher has already been cleaned. We'll show you the cleaning procedure at the end. We then test the hydraulic lift. We make sure that the battery, after installed, it will go down and it will go up, and there's no issues. It's smooth operation. After that, we make sure that we have a spare battery on board. So we will always make sure we have a second battery in addition to the one that is here in the machine. We verify that we have all the equipment we need, such as pillows, blankets, sheet, the base cover. Underneath this will be a PP pad as well, and then the roll board. If you are running multiple trips where you cannot get back to the shop, you will need to have multiple sets of all of these things so that you can do your runs. In the morning when you get in, make sure that you come here to this board. This board will have important notes for the team here, and then this will be the schedule of the vans that go out along with what stretcher you're supposed to use and if you need a board or not. Okay, we are here going to show you how to do a transport of the patient from the bed onto the stretcher. When you first get into the room, you have to orient yourself, make sure obviously the head of the stretcher is with the head of the patient. We will then bring the stretcher over. Make sure you remove this sidebar here so that we can transfer the patient. Then we will lower the stretcher down until it's just slightly lower than the bed. If the patient is able to roll over to their left side, you would ask, Jeff, are you able to roll over to your left side? No. If the patient is not able to roll over to their left side, then we will ask either for help or try to maneuver the patient using hips and shoulders so that he goes over to the left side. Again, this will be done with some assistance from the folks at the homes. Now what you do is you're going to tuck this sheet up underneath the person. Make sure it's tucked well because you will have to pull this out from under them on the other side. Once it's properly positioned, okay, sir, you can please go ahead and lay down again. Thank you. Now we're going to have you roll over to your other side, and this is where you pull the sheet through so that you have a place that you can grab on both sides as you make the transfer. Okay, sir, you can please put yourself back normal. And now we will always ask the patient to give themselves a hug during the transfer. That protects them and assists us with the transfer. Now, since this patient is a little heavier than normal, we will ask for help. So we need help. Help comes in and So here we go. 1, 2, and 3. Now that's the way that you can do it with just the sheet. We're now going to show you how to use the roll board. So now we're going to show you how to use the board. The sheet has already been placed under your patient. In this case, your helper here, your attendant, will pull on the one side while you tell the patient, hey, we're pulling you over to your left side, Jeff. And then you put the board underneath. Once the board is placed, we carefully place the patient back on the board partially, and make sure to at least do one of the feet if you can't do both, and try to get them on the board. It makes for easier transport. Then we're positioning the stretcher, again making sure that the wheels are locked. Also make sure that the bed in the place is also locked. A lot of the beds in the nursing homes move, so make sure that is also in place and locked. And then using the board, again, hips and shoulders at a count of 3. 1, 2, 3. Now that the person is on, you make sure the sidebar is off here, and I will now roll the patient to the right so that the board can be removed. Once the patient is placed, we will undo the brakes, move away a little bit, and get this board up. So, okay, now that the patient is ready, we're going to secure him for safe transport. So we'll start at the feet. At the feet, we will strap him in. Also at the waist, make sure that your straps are always straight and not curved, which this one is. Okay. Then we will also have head straps. Now, we will also say, lift the patient up a little by the head. Jeff, we're going to lift you up, always talking to the patient as we do our procedures. Then we will bring forward the restraints here that will go around their shoulder. And also then up through their arms. So now, there we go. So if you have a patient that is a little bigger, then you can come here and get a extender so the patient is comfortable. We don't want to squish anyone. All right. And then these straps will go up between the arms. And we'll ask you to lift your arms. Thank you very much. And then these will be put together as so. And if you cannot reach, which might be, here we go. There you go. Now, another way that we can do this, if you have a very broad patient, you can then also add an extension here so that it would look like he's wearing suspenders. Otherwise, you'd have this V shape.
In the morning, come to your assigned van, open the back, you'll see a ramp. On the ramp, there are latches, like that. Unlatch the latches, bring the ramp down. Now, to install a stretcher, you must first install a latch bar, like this one, and you install it. With a screw. It comes out like that. Set the latch bar in place, screw it in. And back here, or up here, is where the head of the stretcher locks in. I don't know if you can see this, but these are called antlers. And yeah. Next, after all that, once your battery has been safely placed inside the stretcher, you want to take the stretcher like such, going up the ramp, lowering it as you go. Make sure it's all the way down. And the stretcher latches in like that. And then after that, you want to make sure you have 2 batteries. So always grab an extra battery, because this one might fail. You never know.
Okay, so while we are doing this activity indoors, we want to just let everybody know that you will be outdoors most of the time, right? You're coming from a facility or hospital, and you're going to be transporting outdoor, usually under a portico, but it could be windy, might be rainy, right? So we make sure that the patient is always comfortable, and we'll put a blanket on them to make sure that they're not cold, because again, these are a lot of older folks, and they will complain about it being cold. So we make sure that is done. And now we can transport the patient into the van. Okay, so again, when you're outside, there'll be potholes and ramps and things. So you need to just let the patient know if it's a little bumpy. But again, we will use all the ramps and access points for handicap access. So now as we push the stretcher into the van together as a team, working together. All right, we're bringing you in, Jeff. Here we go. We push up. We start lowering the head. And as we go up over the bump, with the first set of wheels, we lower all the way so that the antlers can be accessed appropriately. Go. And don't lock it in. It's important to remember that as you push the stretcher in, that the bars on the bottom of that stretcher are going up the shaft of the antlers properly, so that eventually you will lock it in just like that. When your patient is comfortably, securely in the van, make sure you have all your equipment, such as your board, because you will need it when you get to your location. We can store that right here on the side. We will always let the patient know, hey, if you feel anything during the ride or uncomfortable in any way, you just let us know. Otherwise, the ride's about 20 minutes. Then he will come back out here and we will close up the van by putting the ramp in, making sure that the latches are down. And now you can transport your patient. Okay, so now that you've arrived at your destination, it's time to unload your patient. Lift up the back of the car. Undo the latches for the ramp. While that is going on, my assistant would be in the front, making sure the patient is ready to be removed so he can help from the front. At this point, you will hit this red bar and pull slightly to release the patient. Then, with the help of your assistant in the front, we will slowly guide the patient safely down. And as we do so, we can begin to lift him. Then you just follow the procedures for getting them back in bed that you saw earlier with the sheet and the transfer board. Okay, so a couple of little extra things we're going to talk about here that were not shown in the training. Some folks here might have a urine bag, and that urine bag, when you're at the facility, will be possibly hanging on their bed. And then sometimes they will hang that on the frame of the stretcher. It is very important that when you are doing the transfer, that bag not be on any sides, because you could possibly smash it or break it in the van, which we don't want. So what you would do is you would place that here in between the person's legs, on their legs here, before that transport. They may also have oxygen. So when we are bringing the stretcher into the van, it is important for you, if you're the attendant at the back, to wait for the attendant at the front to manipulate that canister in a proper way so that it is safely contained for transport. You may also have a lot of patients have problems with their feet. So the feet can be very bandaged up. They could have pins in them, a box around it, all sorts of stuff. I mention that only because when we transfer, it is very important when we transfer from bed to stretcher or back, that we have at least one person, no matter the weight of the person, helping with those feet so that we don't damage anything as we transport the person. Okay, when you are transporting patients, sometimes the elevators that you use may be too short to allow for the stretcher to be at its full length. This is how you can get into a shorter elevator. You must first place the brakes on the stretcher, otherwise the whole thing is going to move. Then come back here, press these red handles, and push in this black bar as far as it will go. This allows you to get a couple more feet where you can get into a smaller elevator. It's very important that once you've done this and transferred the patient and you're about to put them in the van, that this comes out all the way again, because if you do not do this, the stretcher cannot be placed properly in alignment with the bar. Once your patient is off the stretcher and you're back in the shop, we have to clean the stretcher and all the equipment. We use the Lysol and the wipes to do this, and we'll show you now. So what we do is we take the board off and we will spray the board. While I'm doing that, Ian will strip these sheets and put them away accordingly. So we spray on both sides here and then let that air dry. We also lightly spray this pillow. Each pillow is plastic wrapped, so there's no harm to do that. After undoing all the straps, we'll carefully put all this away. This will be thrown away. All other items are laundered and will be placed in the appropriate container here. Now we have to clean the bed of the stretcher. So if you want to do it, there we go. Get one of these things out of here. You can do that better than me, maybe. While we're doing that, also what has to be done is the straps have to all be sprayed down. So we go ahead and do that while he's getting that ready. Spraying all of this. Also, don't forget to spray down your extenders because you may have used them. It's just best to do it when you're doing all the others. Boom, boom, boom. All the way around. Nothing here. This one. All right. The next thing to do after this dries is to remake your stretcher bed in the fashion that you saw at the beginning. Okay, so now the stretcher is clean and we can begin assembling for the next run. Go ahead, you put your PP pad down. Then we work with this lovely pad. This pad has a base and a head. It's very obvious where the head will go. Always remember to wear your gloves when you're cleaning the stretcher. Then we will make sure that we have all the items that we need. Oops, we have here a sheet. Whoops. Okay, we have a sheet that will be used. We have a pillow, a blanket, pardon me, and then the pillow, which we will put the case on. Bada boom, bada bing. Okay, once all the items are on the stretcher, we will go ahead and put the straps back on. Of course, I've got the pillowcase that does not want to cooperate. All right, once everything is ready, we reposition all the straps and make sure that we have our board and everything is good. All right. And now we go ahead and strap it so that, because what you don't want to do is leave it in a condition where the person after you is going to have to clean it. All the stretchers are ready to go. Okay. And then it is placed back in the row of stretchers. Oh, and the board. Yes. Again, if you had multiple runs on one day, you do all this a number of times.